Good morning everybody, Dr. Brace here, and it's Facial Plastics Friday. Today will be a quick one. I want to talk about the basics of skincare. I had somebody ask this week in clinic, what do you do for your skin? And there's nothing really magical. There's 4 basic tenets to skincare that everyone can benefit from. And I'm gonna share those for you right now. The first thing you can do for skincare is an exfoliator, and the one that I prefer and recommend would be a weak acid exfoliator. So something like an alpha hydroxy acid or a beta hydroxy acid, glycolic acid, those sorts of things. And what a exfoliator will do will remove the keratin or the upper layer of your skin off so that your skin is brighter, but also so that everything else that you use on your skin will penetrate into the skin better and have better absorption and get a better effect. So number one, use an exfoliator. I use the Skin Medica AHA BHA every day in the shower. Number 2 would be retinol. Now retinol is a vitamin A derivative. It is an active ingredient, and it 100% causes everyone that uses it to have red, dry, flaky skin when they start. So a lot of people start with retinol and say, it doesn't work for me, I'm allergic to it, I didn't tolerate it, I can't use it. You have to go low, or start low and go slow with retinol. And so if you start using retinol, you will get that dryness, you will get the redness, you will get flaking. Stay with it. You can start every other or every third day on a low concentration, and then you can work yourself up to every day, and then you can move up in concentration as you tolerate it. But what retinol will do will be to cause your epidermis, the upper layer of your skin, to continually kind of slough off, exchange, so you have newer, fresher skin on the surface at all times. It speeds up that epidermal maturation process, and the end result will be smoother skin tone, fresher looking skin, just healthier looking skin. Now retinol, especially here in Canada, retinol makes your skin more photosensitive or more prone to sunburns, and especially like a weekend now where we have a long weekend coming up. In Canada, we get very little sun. We all go out in the summertime, and if you're not really good with sunscreen, you could end up with a burn. And so if you are using a retinol, you have to be really careful about sun exposure, and you should be using a SPF or a sunscreen. You should be using that anyway, because that's the third thing in a skincare routine. You exfoliate, you use your retinol, and then you need a good sunscreen, a good SPF. I recommend anything over 30. So there are some great ones out there. Vivier, Skin Medica are the ones that we carry in our office, but an SPF with at least a sun protection factor of 30 or above will help protect your skin. And that's not only because the retinol makes you burn, but because sun causes solar elastosis, causes damage to your collagen. It causes your skin to become more wrinkly and have more discoloration. And so you're protecting your skin from those sun changes that are not necessarily malignant or pre-malignant changes, but can change the overall look. The last thing is a moisturizer. As I mentioned, the retinol will make your skin very dry, and so you do want to use something that will keep your skin moist. I really like the Vivier moisturizers. I really like the Skin Medica moisturizers, and I use both of them. And that is basically my skin routine. You use a weak acid exfoliator, you use a retinol, I tend to only use that in the winter, a good sunscreen, and a moisturizer. And that's it. That's the basics of skincare. There are lots of other products out there that can target certain specific concerns about your skin, but if you want to start basically what everyone should be doing, that is the secret. There's not much secret to it. It's pretty basic, scientifically proven kind of baseline skincare, but that's what I would recommend. Everybody have a great long weekend, stay safe from the sun, and have lots of fun. Bye-bye.